Good morning. Good morning. Confirm that you can hear me. Do me a favor, guys. Confirm that you can hear me. If you're watching live, just say hello for me. Let me know where you're watching from. And please let me know you can hear me. I had mic issues last time, and I want to make sure that I am not mute. I'm not, I don't have any mic issues. Let me go here. We're going to get started in a moment. Oh no, I just thought about it. Okay, good. Denisha says I can hear you. Okay, guys, so we're going to get ready to get started. I don't want to put it off any further than what we already are because I am having some internet issues. So I'm going to go ahead and get started. Let me just pulling this up on my phone so that way I can see the comments because my other device is not connected to the internet either. Okay, let's see. Good morning. Good morning. I see somebody from Houston. Okay, loud and clear. Okay, good to know. All right, so we're going to get ready to get started. As I mentioned in the last video that I did, one of the pieces of feedback that I got was that when people are watching the replay, when I answer a lot of questions during the live, they are not able to Oh, you know what? Hold on one second. Let me make sure I'm sharing my screen. I just realized. Sorry, guys. One of the pieces of feedback that I got from people that's watching a replay said that when they are watching a replay, it's one thing when you're live. You guys aren't on here now. It's one thing when you guys are live. But one of the pieces of feedback that I got was basically that when they are watching a replay, it's very distracting. So I'm going to get through the exam practice. And then if you have any questions at the end, just feel free to ask any questions. So that way, if you happen to be watching a replay, you're not distracted by me stopping to, engage with the audience and things like that. So if I see something I need to address, I will. But for the most part, I'm going to wait until the end to answer any questions. Yes, Teresa, this is for the updated NHA exam. Now, if you are not taking the updated exam in January, this will still help you. And so this is going to take me to my frequently asked questions slide. So people ask, will your old videos still be helpful if I'm taking a new test? Absolutely, because a lot of the information is still the same. It's just that the new test has added some questions, has added some content, okay? Will your videos help if I'm taking a certification other than the CCMA? Yes, they'll help. If you're taking the RMA, the CMA, any of those other certifications, it will help. However, because the questions are, the same, it will help. However, I always recommend you to get the study guide for those tests because I may not cover something that's going to be on those tests. Those tests are bigger. But what do I do if I fail the test? You can take it again. It's not uncommon. Just make sure you double down on studying the areas that you fell short. Okay. Can I get a job if I'm not certified? Yes, some places will hire you and then require that you get certified within a certain amount of time. Some places won't hire you at all. So it is best to get certified. However, if you don't have the certification just yet, it is still possible to answer that question. And can you give me some study tips? Now, this next slide, I always tell you guys you can go ahead and screenshot it. This is just a few tips. You want to let your life revolve around your study materials leading up to your test. So, for an example, you guys, one of you may be taking your test next week. Every day, you should be studying, right? Going through your modules on your study guide, going through your wrong answers that you've taken notes on in your practice test, right? My group on Facebook is called the Medical Assistant Lounge. Feel free to join it. Make sure you answer the questions to be automatically approved into the group. Pay close attention to the wrong answers on the test, right? And that's why I always say make sure you have a pen and paper while we're going through those questions, because you want to take notes on those as well, because guess what? Those wrong answers are going to be on the test. Don't focus more on the questions than you do on the content. One of the big things people will say, I didn't see any of these questions on the test. You're not supposed to. Now, some people do. Some people actually do see some of the questions, but you don't get caught up in the questions, because the exact questions will not be there, but the content will. All right. You can create flashcards. Pay close attention to each question. Recognize keywords in your questions. Okay. Use process of elimination. Sometimes you're going to get to some questions where you really don't know the answer. You maybe have never seen this before, and you really are using process of elimination. You're taking the time to look at each answer and rule out what you absolutely know that is not. Okay. Answer your easy questions first and flag the difficult questions to come back to later. This is a big one. When you guys are taking your test, depending on which one, if you're taking like the CCMA, you get 3 hours. Those 3 hours fly back. I've literally had students who, the test literally cut off while they were testing, but then they were able to pass because they had answered enough questions to pass. Okay. That's why you want to get through those easy questions first, and then flag the ones you need to spend a little bit of time on and come back to them later. Okay. All right, so let's get into it. All right, which of the following is not true of extended release oral medications? They can be crushed and chewed. Extended release pills provide a consistent amount of medication for my body to use over a period of time. They need to be taken with plenty of water, or I should take my pill at the same time each day. Which of the following is true? Now, if this is not true, I'm sorry. Keyword is not true. That's what I mean by paying attention to keywords. Which of the following is not true? One thing, if this is your first time joining me, let me know in the comments if this is your first time joining live or even watching one of my videos. So the way it works is that I will read the question out, and I'll give you guys a few seconds to put the answer in the chat, and then I'll reveal the correct answer. If you happen to get an answer incorrect, it is okay. Don't be shy. This is what these sessions are for. So it is okay. And as I mentioned at the beginning, when I first started, I'm having some internet issues. I don't know what is going on. So if I happen to go out, please let me know. I'm hoping and praying that I don't have any issues. That's why I want to get through this quickly. But lately, I have been having a lot of internet issues. I was supposed to do this live earlier this week, but I was having internet issues, so I couldn't. And my laptop, I have an HP. For some reason, it won't connect to the internet. And I had an HP years ago that did the same thing. It just stopped connecting. Let me know if you guys also have had an HP and had issues with that. I don't know if it's me. I don't know what it is, but I am on an older laptop now that's not quite holding the connection. So hopefully we don't have any issues. But let me know if any of you guys have had any issues with your HP as well, because this is the second time. All right, I see the answers rolling in. All right, so if you said A, you are correct. That is not true. They cannot be crushed and swallowed. They need to be, I'm sorry, they cannot be crushed and chewed. They need to be swallowed whole. Everything else is true. They provide a consistent amount of medication for my body to use over a period of time. Keyword extended release. They do need to be taken with plenty of water, and they do need to be taken at the same time every day. So good job. All right, next question. Which of the following are flat areas of skin that are different colors than the surrounding skin? It has no elevation or depression, and a common example is a freckle. Now, this is another good example of paying attention to the wrong answers, because I'm going to explain what each wrong answer means. Okay. Hey, Victoria, I'm glad you made it too. All right, let me see. Oh, let's see. Oh. Let's see if any answers on to come in. I don't see any answers coming up. Ladies and gentlemen, just let me know that we're good. The connection is good. You guys can still hear and see me. Okay, I see an answer now. Let me know if you guys can still hear and see me. I'm gonna keep checking in periodically because I'm having these issues, these internet issues. So just please forgive me in advance. I gotta keep checking and make sure. All righty. Okay, so I did see a couple of people put A. So if you put A, you are correct, my cue. So let's talk about these other ones. Good example of, again, paying attention to the wrong answer. So this way, if you happen to see one of these other options, you know what the answer is. This is a key example of taking notes on the wrong answer as well. So you got the answer for my cues is right there, right? So for pustules, those are pus-filled blisters, right? Like acne. The papules, so those are solid elevations. They are less than zero point 0.5 centimeters. An example of that is allergic eczema or eczema. And then the vesicles, those are fluid-filled blisters, like herpes viral infection. Okay, so make sure you guys write that. So just in case you see one of those on your test, you already know it. All right, which of the following can be used to wipe away sweat or lotion before placing EKG leads on a patient? Hydrogen peroxide, witch hazel, betadine, or alcohol? All right, so let's see. All right, if you put alcohol, you are correct. So if you're doing an EKG placement, you want to wipe away sweat or lotion, you want to use alcohol. And let me just speak on that just for one moment. When you're doing an EKG on a patient, when I'm doing an EKG on a patient, I always ask, do you have on any lotion? If they do, I just automatically get an alcohol pad and just wipe the areas that I'm going to be placing the leads, the electrodes, just because I already know that they're going to come off. Now you may have some paper tape that you can use, but you want to just be proactive, because what I've realized is that if you try to do it and then you realize they won't stick and then you won't get a good reading, a clear reading without artifact, you're going to end up having to do it all over again. So in the beginning, just a tip for you guys, just go ahead and wipe them off with alcohol. And you may even have some other little pads too. Like in cardiology, we have other little pads that's even better, that helps to get the skin nice and dry before placing electrode. So just want to give you a quick tip on that. Hydrogen peroxide, guys, we use that to clean it like a wound, like to prevent infection. Also can be used for your gums. Hydrogen peroxide can also be used as a mouth rinse, which hazel is like for reactions and itching. Betadine, that is a sterile cleanser, a sterile antiseptic. Okay. All right. So she says she can hear me. Okay, good. Just let me know if I go out at any point. Okay. All right. Which part of the chart do we document tobacco and alcohol use? Are we putting it in the past medical history, social history, family history, or surgical history? And I'm just going to exit out of here just for one moment and share this video to my YouTube. I'm sorry, to my Facebook group. I forgot to let them know I'm live. Do me a favor, guys, too, while you're watching, like the video if this is helpful to you. Just like, you can exit out for a moment and like the video if it's helpful to you. It helps the algorithm get out to more people that need the content. So I'm just going to go to my group real quick, let them know I'm live. Oh, actually, let me go to my page and also post it in my group. That'll be helpful. All right, so let's see. Let's see what you guys are saying. Okay, I see all the answers. All right, let's see. All right, so if you said social history, you are correct. So, of course, past medical history, that's where we're going to put all of their past, diagnoses, any, past any past history, right? Their current even current medication. So let me address this too. Even though it says past medical history, that's going to encompass their some of their current history as well, like their medications, right? Any type of diagnoses they've had, any type of illnesses they may have had or have. The family history, of course, self-explanatory. That's going to be the family history. Surgical history is any procedures or surgeries they've had, and surgical history a lot of times will be in the past history, in the patient history. So that's one of the questions my students always ask: what's the difference, the past history or patient history? Both, both PH stands for both. They won't ever have you choose between both of them, because PH can mean literally both past history and patient history. But a lot of the history, the patient's history, will be encompassed in the medical history, just a FYI. But like I said, you'll never have to choose between both of them. And then social history is the drug use, alcohol use, exercise habits. If you're working in like GYN, they may even get even more into detail about how many partners the person have had. When I worked in GYN, that was one of the things we did, ask how many sexual partners. So all the social history there. It's called Nanalina. My page on Facebook is called it's called Medical Assistant with Miss K, and the group is the Medical Assistant Lounge. All right, which of the following medical terms mean crushing? Tripsy, plasty, itis, or anti? But yeah, Nanalina is the same as this YouTube page. All right, medical terms mean crushing. Which of the following means crushing? And guys, terminology is so key. Sometimes that's going to literally be the key in you getting the answer correct. It's going to be knowing your terminology, because you're going to be able to rule out certain things, because that that term. So make sure you are up. Always say, make sure you can recognize all of your body parts. First of all, you should know every single body part, the medical term for every body part, all of your organs, right? Start there. And then your common suffixes, your procedures, and your, some conditions, right? Your prefixes. You got to know medical term. That's like one of your foundational things. All right, so let's see. All right, so if you said tripsy, you are correct. Tripsy is referring to crushing. Plasty, of course, we know that's surgical repair. Itis is inflammation, and anti is against. So if a medication is anti tussive, that means it's supposed to prevent coughing, right? Or antipyretic is supposed to reduce fever, right? Anti is against. Okay, Nandaline, I'm glad you made it live for the first time. All right. A patient who refuses to accept their diagnosis is in which stage of grief? Denial, anger, bargaining, or depression? You got to know your stage of grief as well, and the order. And I'll just kind of go over that after we get the right answer, after I show you guys the right answer. But you got to know the stages of grief. Again, make sure you're studying the content and not the question in itself, because this question may not be on there. However, one of the other stages of grief may be on there. So this is what I mean by studying the content and not the questions. When we're going through these test questions, when I'm going through with my students, I don't even let them take screenshots of the questions, because a lot of times they're like, Miss K, scroll up. Let me get a picture of the question. I don't even let them take pictures of the questions because I don't want them to focus on the questions at all. I only screenshot the once we go through and it explains each of the answers. I only let them screenshot that. I don't want anybody to get caught up in the questions. All right, so if you say denial, you are correct. You are correct. So denial is the first stage. So let's just quickly talk about those 5 stages of grief, um, by Elizabeth Kubler-Ross. So Kubler-Ross was a psychologist who came up with this theory of the 5 stages of grief. So the first one is denial. So first of all, just remember this acronym DABDA, DABDA, DABDA for the 5 stages. So you got the first is denial, right? They're refusing to accept their diagnosis. And let's just point it out. Let me just point out too that the stages of grief refer to the stages of grief for a patient in which they are diagnosed with maybe a terminal illness. This also refers to stages of grief when a person is actually going through grief. Maybe they've lost someone, okay? But anyway, so denial is the refusal to accept what has happened or to accept the diagnoses, right? Anger is being angry. Maybe the patient is even angry with the provider. Maybe they're like, why didn't you catch this sooner, or whatever, or maybe angry at themselves or their loved one or whoever. Bargaining is when they begin to try to work it out. Think about what bargaining is when you're bargaining with someone, right? You're trying to work it out. You're trying to negotiate. Bargaining is like when a patient is like, well, maybe if maybe they were diagnosed with a terminal illness and they, well, maybe if I start eating right, I can turn this around. That's bargaining. Depression, you guys know what that is, extreme sadness. That's when the patient begins to, kind of give up hope, right? And then acceptance is the last one, and that is the acceptance of their diagnosis, right? So again, DAB, denial, anger, bargaining, and depression. Which of the following types of technology uses webcams and internet video chat to provide medical care? Is it telemedicine, virtual private network, speech and or voice recognition, or encryption software? All right, let's see. Yep, if you chose telemedicine. So you guys, I'm pretty sure you guys probably know that just being on the patient side as well, like telemedicine is and virtual visits were already kind of becoming a thing prior to COVID. But of course, COVID being in a pandemic kind of made it well, not kind of, I didn't even mean to say kind of, but it made it like necessary. So for some providers, this is the only way they could see patients, even though we did have some providers that were still open, right? And we're seeing a select amount of patients, but some people could not be seen at all in person. All we had was telemedicine to rely on. And then virtual private networks, speech and or voice recognition is not one. Encryption software. So you guys know encryption software is software to keep information private, so people cannot easily read it. So like it'll be like decoded. Like if somebody tried to hack like your email or something like that, the software is they use encryption software. A hacker wouldn't be able to see the information. All right, which of the following techniques involve killing pathogens and rendering them inactive? Sterilization, disinfection, sanitization, or hand hygiene? Okay, I'm just putting a comment in my group really quickly while you guys are doing it. I'll be right back. I'm still here, but I'm just commenting in my group for a second. Okay, let me go back into YouTube here. Okay, you're welcome, Renee. She says she's currently in school. From okay, you're so welcome, Renee. I really actually enjoy this. This is what I do on a daily basis anyway with my students, so I enjoy it. Yeah, so disinfection, right? So disinfection is killing pathogens and rendering them inactive, right? Sterilization is the complete process of destroying all microorganisms. Sanitation is reducing the number, and we know hand hygiene is simply washing your hands, right? All right, so let's see what we got here. After applying pressure following a venipuncture, how long should you observe the site before applying a bandage? 5 to 10 seconds, 15 to 30 seconds, 45 to 60 seconds, or more than 60 seconds. After applying pressure following a venipuncture, so if you join your patient blood and you're applying pressure, how long should you observe the site to make sure there's no leakage before you apply the bandage? All right, I see the answers coming in. All right. So if you said 5 to 10 seconds, you are correct. 5 to 10 seconds. So again, this is after you've applied pressure, right? Following you drawing your patient blood after you've applied pressure to make sure there's no leakage. You want to observe it for about 5 to 10 seconds before you put the bandage on. All right, which of the following ensures healthcare professionals uphold and respect a patient's choice regarding their medical care? Is it the Affordable Care Act, the Good Samaritan Laws, Patients' Bill of Rights, or the Civil Rights Act? And ensures healthcare professionals uphold and respect the patient's choice regarding the medical care. And again, pay attention to wrong answers. Maybe some of these things you may have never seen before. So this is the importance of paying attention to the wrong answers as well, right? Because now I'm going to explain what all of them means, right? So you want to make sure again you're writing them down. Have a pen and paper while you're going through this. For anybody that just joined, I see a few more people just hopped on here. So make sure you have a pen and paper. Even if not right now, maybe you'll watch the replay later. Just take notes so that way you know what everything is. It ensures that healthcare professionals uphold and respect a patient's choice regarding their medical care. All right, I see the answers coming in. All right, yes. So if you said the patient's Bill of Rights, you are correct. It is the patient Bill of Rights that ensures we uphold and respect the patient's choice, right, regarding their medical care. So the Affordable Care Act, that is the act that made it mandatory to provide affordable health care, right? The Good Samaritan laws protects us from um literally being a good Samaritan for helping people out. So like for an example, if you had to give CPR to a victim while you're out and about, right? It protects you if in case you happen to harm them, which happens often during CPR, that maybe you may fracture a person's rib. You are protected by the Good Samaritan laws. Now, Good Samaritan laws doesn't protect us when we're at work. That is just when you're out and about and you're helping save someone. That is being a Good Samaritan. At work, you're just doing your job. So that applies to when you're again out and about. Civil Rights Act. protects us from discrimination, right? Okay. Which of the following actions should you take when preparing a patient for their upcoming virtual visit? Schedule a patient a visit with the hospitalist. Ensure the appropriate release forms are completed by the patient prior to the visit. Ensure the provider has all required equipment in the medical bag for the visit. Or you're going to tell the patient to arrive to the office 15 minutes before their scheduled appointment time. That's okay, Shantoria. Don't be sorry. You can always watch it later. Don't be sorry. You are fine. I normally don't do these on Saturday mornings. Thank you guys for joining in on a Saturday morning. I was supposed to do this early in the week, but I've been having internet issues. And of course, Thanksgiving was Thursday. So I was preparing to cook and everything. But I had planned on going live actually on Tuesday or Wednesday. But I don't know what's going on. I've been having internet issues. Okay. Oh, Amber. Okay. You're getting a early start. She says she's only 2 weeks in the class, but she's going to say B. That's good. You're getting an early start. All right, so let's see. Yes, you are correct, Amber, and everybody else that chose B. Ensure the appropriate release forms are completed by the patient prior to the visit. Keyword is virtual. So we wouldn't schedule them with the hospitalist unless they're going to the hospital, right? Or ensuring the provider has the equipment, medical bag for the visit, or have them arrive 15 minutes. Keyword is virtual, virtual visit. Which of the following is a proper time period for the collection of a newborn screening card? Within 48 to 72 hours after birth, within 24 to 48 hours after birth, 8 to 14 days after birth, or 15 to 28 days after birth. The newborn screening card, when should that be done? Hey, Kendra, my name twin. She says, I got started 2 months ago. Every other every other week is a test. That's actually better than every week, Kendra. We have a test or quiz every week. All right, I see the answers coming in. Let's see. Yep. So if you guys chose B, which it looks like everybody did, within 24 to 48 hours after birth is when a newborn screening card is done for the collection of the newborn screening card. All right. How should you communicate with the group of diverse patients? Include slang, incorporate generational terms, use a calm tone of voice, or avoid eye contact. This one right here is probably self-explanatory. I will tell you guys sometimes you do get some questions that are like really just kind of easy like this, right? Because you can look at them and say, you know what, I know exactly what I'm not going to do, right? um so you will have some questions like this where you're just going to be able to fly through, which I see you guys are flying through this. Everybody's putting their answer. All righty. So of course we're going to use a calm tone of voice. Everything else, we're not going to do any of that. We're going to use a calm tone of voice, right? We're not going to include slang, incorporate generational terms, avoid eye contact, but we do want to use a calm tone of voice. All right, which of the following links in a chain of infection describes a site where an infection can be stored? Is it a portal of entry, the susceptible host, reservoir, portal, or the portal of exit? Make sure you guys know that infection cycle. One of my students, we laugh about this because she always say that the chain of infection has her in the chokehold. That was one of the things she struggled with the most. She like, Miss K, this thing has me in the chokehold. But she got it toward the end. Alrighty. So if you chose a reservoir, you are correct. So let's talk about this chain of infection, right? So let's talk about it. So the reservoir is where an infection can be stored, right? That's the first link, right? And the chain of infection is the reservoir host, right? Reservoir host, right? Then you have the portal of exit. The portal of exit is how the infection leaves the person, right? So whether maybe they'll sneeze, right, or maybe they'll cough, is the portal of exit, right? And then the mode of transmission or the vehicle of transmission is how it's picked up by the next person. Okay, so the reservoir host is one, portal of exit is two, the mode or vehicle of transfer of transmission is three, right? So it's how it's transferred. So let's say the person sneezes, right? And then maybe their droplets gets on the table, right? Or even directly on the person, the next person. That is the mode of transmission, right? The next one, four, is the portal of entry, how it enters that next person. Maybe once that person touches that table where that droplet was, or maybe that droplet landed on that patient's arm. Well, not necessarily a patient, but person's arm. They touch that spot, and then they rub their nose, or they touch their face or whatever, right? That's the portal of entry for them. And then a susceptible host is the last link. That is the person that is then infected, right? So make sure you know the links. Again, we got reservoir host, portal of exit, mode of transmission or vehicle of transmission, portal of entry, and then susceptible host. Okay. Which immunization is recommended by the CDC to be administered every 10 years? Zoster, influenza, tetanus and diphtheria, or pneumococcal conjugate? Which of the following is recommended every 10 years by the CDC? And I'm still here, guys. I'm just back in my YouTube group responding to a couple of these comments. Just click on the link to join. All right, so let's see. All righty. So if you said tetanus and diphtheria, you are correct. So zoster pneumococcal, that's once in a lifetime after a certain age. Pneumococcal, I know that's after 60. Zoster, I want to say, is that after 60? Is that after 40? Wait a minute. Let me see. I got a note on that. Okay, that's after 60 as well. Both are after 60. Pneumococcal is after 65. And then the influenza, we know that's every year. And then tetanus is every 10 years. All right, when should you post a credit adjustment to the patient ledger? Before the balance on the EOB is entered, at the same time the payment is posted, within a week of services performed, or after the check is returned from the bank? When should you post the credit adjustment to the patient ledger? So patient, you're posting a credit adjustment to the patient ledger. When should that be done? The patient has made a payment. Some Scarlett Noble says, I have a phlebotomy test January 12th, my CCMA class. Do you have any videos? Oh no. So there are some phlebotomy questions on here, but I don't actually have any videos on phlebotomy besides the video that I have demonstrating it for my students. But no, I don't have a video specifically on any phlebotomy questions except the ones that are included in the CCMA. And then, as I mentioned, I do have a couple of videos on that. All right, so if you put B, you're correct. At the same time the payment is posted. So that's when you're going to post adjustment, when they're making the payment. What is an EOB? This is a good one because you got to know what that is. The EOB is the explanation of benefits that goes to the patient. It breaks down the charges of the visit, right? It shows the patient how much was denied, how much was covered, how much of the deductible was applied, all of those things that goes to the patient. The version of the EOB that goes to the provider is called the remittance advice. So that's a good thing to make a note of as well. EOB goes to the patient, right? Shows all the charges, what was denied, what was covered. The provider version of that is the remittance advice. Okay. So if you get a question that says which of the following went to the provider and list all the charges, right? And what was paid, what was denied, keyword, it went to the provider. If it says goes to the patient, that's the keyword. It goes to that's the EOB. Okay. All right. Patients are influenced by cues to action if they are influenced by which of the following: family, social media, age, or their peers. Patients are influenced by cues to action if they are influenced by which of the following. And can you guys do me a favor and like this video? I see there's 40 people watching right now, 39 people watching right now. Do me a favor and just like the video if this is helpful. Just helps with the algorithm and getting this information out to more people. Thank you. Okay. All right. So let's see. All right. If you said social media, you're correct. So patients that are influenced by cues of action are influenced by social media, um, campaigns, mass media campaigns. That means they are influenced by cues to action, right? A cue to act, right? Um, Family and peers will be consider social influences. Okay, social influences, and then age is considered a personal factor or personal influence. Now, this is on a new again, this study practice today is from the new updates. And as you can see, a lot of the information is the same, right, from the old ones, but this is one of those questions that is new. All right, so which of the following is true regarding the storage of medication? That all medications should be stored in a refrigerator. To save space for new medications, the same medication should be combined into one box. Stock medications and sample medications can be stored together, or controlled substances should be stored in a location that is different from regular medications. Um, can you explain the question? I'm guessing you're talking about the last one. So, my I think you is my. I'm sorry. So, on that last question, so there now the new updates have questions about patient influences, and it's just asking like, um, there's different factors that influence a patient's decisions about their medical care. So it's just basically asking like, it'll say like which of the following is a personal factor that it will include that will influence a patient's opinion about their medical care. A personal factor is their age, or what was another? Their age, and um, maybe it was location. I can't remember the other one, but age was a personal factor. Basically, things that influences the patient's decisions about their medical care, or even just their thoughts about their medical care. So you got personal factors like age, then you have social factors like family and peers, right? That can affect the way a patient thinks, because think about the social influences that they have in their lives, right? Like, how some people, they will go to their family and friends and get their opinions, and then next thing you know, they have their opinion formed based on what somebody told them. Maybe they went to their patient, maybe they went to their family, and their family was like, oh no, you need to get a second opinion, or this is what happened to my friend or my cousin, right? It's just they're influenced by their family or by their peers, right? Maybe something they didn't even think about, And now they're, they have this whole thought process because of that. And then of course social media, right? So social media, that's an influence by cue to action. Maybe, especially nowadays, there's so much on social media. People are influenced by social media. So that's just what it's asking. Like, what are the different things that patients are influenced by when it comes to their medical care or their medical diagnoses? I hope that helped, Myra. All right. So if you chose D, that is correct. Controlled substances should be stored in a location that's different from other medications. Look like everybody pretty much got that one. All medications don't necessarily have to be refrigerated. If it has to be refrigerated, it'll say to save space for new medications, the same medications should be combined into one box. No, because one, if you put it all in the same box, and let's say you got one box months ago and another one today, why would we put them in the same box? The expiration dates could be different and all of that. You want to keep the medications in its own box. Stock medications and sample medications. Stock medications are medications that we have in stock, right? Samples are samples that maybe have been dropped off by a pharmaceutical company that they want us to try. And what they do is they'll give sample medications to, so that the provider can pass out to their patients to kind of test them, right? And then that will encourage the provider to prescribe that medication. That's why if you work in a private office, you get a lot of reps to come in and they'll give sample medication. Sometimes they'll even offer lunch. If you're in a private office, you know what I mean. But they want the provider to try that medication. Those have to be kept separate because you got to keep inventory of what you have on hand. All right, which of the following tube is used for hematology tests? Serum separator, light green, lavender, or red? Okay, I don't see any answers popping up just yet. I'll wait a moment. Okay, I see them coming up now. Okay, let's see. All right, yeah. So if you chose lavender, you are correct. You are correct. So SST, the clot contains clot activators, serums, gel separator, keyword SST serum separator tube. Those are used for chemistry, serology tests. Red is used for serum tests. Light green is also used for chemistry studies. When plasma determination and chemistry studies, and then red, oh, I already said red. And then lavender is hematology tests. Alrighty. Which of the following is true regarding scratch tests for pediatric patients? Several allergies can be identified at one time. Patients may immediately leave after the results of the test are confirmed. Reactions will usually occur within 30 minutes to an hour, or reactions are typically noted as a numerical value from 10 to 20. Allergy testing. Allergy testing. Scratch test on a pediatric patient with testing for allergies. Is it true that several will be identified at one time? Should they leave right after? Do they occur within 30 minutes to an hour? Or are they noted as numerical value from 10 to 20? Okay, let's see. All right, so if you chose A, you're correct. Several allergies can be identified at one time. Yes. So patients can't leave right after. You want to have them wait about 30 minutes just to make sure no other reactions occur. Reactions usually occur within 30 minutes to 1 hour, usually from 10 to 20 minutes, 10 to 30 minutes. And then reactions typically noted as numerical value from 10 to 20 should be typically from 2 to 4. All right. Which of the following supplements promotes bone health? Folic acid, iron, vitamin D, or fiber? All right, I see the answers coming in. Okay, so you chose vitamin D. You're correct. Folic acid is helpful for brain function and mental and emotional health. Um, Iron is good for anemia. Um, and then what do we have here? And then fiber is good for keeping the bowel movements. Keeping the bowel movements regular, right? Helps prevent constipation. Which of the following reduces nausea and vomiting? Analgesics, anti-neoplastics, antiemetics, or antitussives? Reduces nausea and vomiting. Analgesics, anti-neoplastics, antiemetics, or antitussives? Okay, I see the answers already coming in. All right, make sure you know what these drug classification means. If you don't already, again, make sure you write them down. Analgesics is for pain, right? Anti-neoplastics treats cancer. Antiemetics, we got that one, and antitussive reduces coughs. Okay, so make sure you know these medication classifications. All right, when assisting a provider with an ankle sprain, which of the following can you expect the provider to prescribe? Ice, heat, a cast, or opioid analgesic? You're assisting a provider with a patient who has a sprained ankle. Which of the following could you expect the provider to prescribe? Is he ice, heat, a cast, or opioid analgesic? Yes, knowing your prefixes, suffix, and root parts helps. Yes, know those terminology, know those terms, medical terms, know your terminology. You are absolutely correct. Okay. All right. So if you say ice, you are correct. So if you say ice, you are correct. So it's not heat, not a cast is not necessary. Opioid analgesic is not necessary. Regular pain reliever is fine. It doesn't necessarily have to be an opioid. Um, Amber said ice and ibuprofen in this opioid crisis. Exactly. All right. Which of the following is an example of durable medical equipment? Syringe, crutches, autoclave, or autoscope? Example of DME, durable medical equipment. Why is this? All righty. So if you chose crutches, you are correct. So that is considered durable medical equipment. Now autoclave, of course, that is equipment that we use to to sterilize instruments. Syringe is more of like a supply, medical supplies, right? Otoscope we use, well, the provider uses to inspect the patient's ears, right? But the durable medical equipment in this case is going to be crutches. Sorry, guys, I'm looking at YouTube and Facebook at the same time trying to answer these questions. Yep, crutches, wheelchair, etc. Yep, it's for the patient. Exactly. Alrighty, let's see. Which of the following may require a patient to have IV contrast and NPO for 4 to 6 hours? X-ray, CT scan, mammogram, or ultrasound? What is NPO? May require to have an IV contrast and NPO for 4 to 6 hours. What's NPO? Got to know your abbreviations. That falls under your medical terminology. Yep, nothing by mouth. Which of the following requires nothing by mouth? IV contrast. Looks like the answers are unanimous. Yep, B. If you chose B, you are correct. X-ray, mammogram, ultrasound do not require IV contrast. You are correct. Or even nothing by mouth for 4 to 6 hours. Oops, I done went too fast. Sorry, y'all. Okay, which department is responsible for blood typing? Hematology, chemistry, microbiology, or immunohematology? All right, so if you chose immunohematology, you are correct. So, hematology is responsible for reviewing the blood cell counts and the morphology of the blood cells, right? Chemistry analyzes chemicals found in the blood, cerebrospinal fluid, and urine. And microbiology is responsible for studying very small infections, infectious organisms such as bacteria, fungi, and yeast. All right, make sure you know what each of the departments um, are responsible for, ladies and gentlemen, because again, you will see these questions on your test. Another good example of making sure you write down the meaning of the wrong answers as well. Which of the following is used to remove cancers of the skin? Electrosurgical unit, operating microscope, cryoprobe, or endoscope? All right. So if you chose cryoprobe, you are correct. What is cryo? Cryo means cold. So it uses cold temperatures to treat to remove the cancers, right? Electrosurgical unit. So that's used to cauterize or burn off something, right? So like burning off blood vessels to reduce bleeding. Operating microscope is used to perform delicate procedures. And then the endoscope is used to examine the inside of a body cavity or inside of an organ. Okay. Which of the following must be entered into the EHR by a provider using computerized physician order entry or CPOE, medical lab test orders, diagnostic test orders, hospital orders, or medications? It has to be entered by into the EHR by a provider using a CPOE, medical lab test orders, diagnostic orders, hospital orders, or medications. Oh, I'm sorry. See, which one? Explain what one. I see. I'm just coming back to YouTube comments. I'm sorry, guys. I was looking on Facebook. Explain that one. Which one? Deja says, "How often do you go live?" My goal going forward is to go live at least once a week. I'm going to try to do twice next week, but I can't guarantee it. My goal is to do it twice next week, but the goal is at least once a week, though, Deja, going forward, at least once a week. The days vary, though. It just kind of depends. Like, I was planning on going live on Tuesday, had some internet issues. I've been having internet issues really all week in my house, period. So I just decided to go live this morning. All right. Yep. So hospital orders must be entered by the provider. Now, medical lab test orders, diagnostic orders, and medications, those can be entered by a medical assistant under the supervision of a provider, but the hospital orders using a CPOE has to be entered by the provider. Okay. The other ones we can do under his supervision, his or her supervision, but this one has to be entered by a provider. The last one, the blood type department, the immunohematology. Okay, yes, the blood type department was the immunohematology department. Hold on, let me just go to the next question real quick so people can start answering that one. So, yeah, which of the following describes a disorder in which a person continually checks the door locks? Panic disorder, autism spectrum disorder, obsessive compulsive disorder, or generalized anxiety disorder? But yes, the blood type department, yes, it was the immunohematology. Not sure the last one before the skin. Shantori, I don't know if you're talking about the same one. I'm going to get through this and then maybe we'll go back to it. Okay. All right. So if you chose OCD, you are correct. So panic disorder is a disorder where a person is constantly feeling like they are in danger, like they're constantly panicking, feeling like there's something that's going to happen, they're in danger. Autism spectrum disorder is a developmental disorder. Person has difficulty interacting or communicating with other people. And then generalized anxiety disorder is a person constantly feels anxious about something. But OCD is like you have the urge to constantly, check something constantly. You hear a lot of people say they're OCD about cleaning up. They have to constantly, clean up something. And let me just say this while we're talking about this, because some people they refer to themselves as OCD just because they're a clean person. But let me tell you, it's so much more than just having the urge to clean up. So don't if you're not really, if you haven't been diagnosed with OCD, don't speak that into yourself, and don't minimize that, because people with true OCD, it's a constant mental distraction. They're constantly worrying, constantly. I mean, like it could be to the point where they could be sitting somewhere and they're obsessed with numbers, putting numbers together, putting letters together. Like it's a constant thing. And so just because you have you want to clean up all the time. You may just be a clean person, right? Some people really do have OCD. I'm not minimizing if a person really does have OCD and they want to clean up all the time, but I think it's one of those terms that's overused so much. But if you talk to a person with true OCD, like, it is no joke. um my mom has OCD with cleaning. Oh, I thought OCD was for cleaning. So OCD, people with OCD, they will have a tendency to want to clean up a lot. They may be germaphobes, constantly thinking that there's germs around. Yeah, I mean, it's possible, but I'm just saying that to say that I see so many people overusing the term, that people who really do have OCD, diagnosed OCD, they're looking like, listen, that's it. I'm constantly dealing with things running through my mind. Like, I have to, it's distraction. I can't concentrate. You know what I mean? So I just wanted to point that out. Like, when you really have OCD, like, it's a constant, never ending thing versus somebody that just likes to clean. Um, all right, let's see. Which of the following is a fracture in which the bone is protruding through the skin? Is it displaced, compound, simple, or comminuted? So I can't. Oh, she says I kind of thought because I couldn't understand why they told me I had OCD with numbers. I have a thing with numbers. Okay, I got. Okay, yeah. So if your doctors told you, if your doctors diagnosed you with OCD, then that's different. I just meant people that's always claiming it. That's all. All right. So we're going with displays, compound, simple, common noodle. Let's see what you guys are putting here. All right, so if you chose compound, you are correct. That is a fracture that has broken through the skin. Displaced is a fracture. The bones are not even aligned with one another, they're completely unaligned. Um, Simple is a fracture that is not broken through the skin. Okay. And comminuted, it's multiple fractures. So the fracture, the bone has multiple bone fragments. It's like actually fracture into multiple bone fragments. Which of the following is the correct order for donning PPE according to the CDC? You're going to put your gloves, gown, goggles, mask, gown, mask, goggles, gloves, mask, goggles, gown, gloves, or goggles, mask, gloves, gown. Which of the following is the correct order for donning PPE according to the CDC? Yep, also known as open fracture. All right, so let's see who's correct. Yep, if you chose B according to the CDC, that is the correct order. I said CCC, sorry guys. According to the CDC, the correct order is gown, mask, goggles, gloves. All righty, ladies and gentlemen. So I hope that this was helpful. Make sure you guys like and subscribe if you're not already subscribed. I see there we got up to 52 people at one point. So just do me a favor and like the video. Someone asked me last time, how can I thank you? Thanking me is really just liking the video, Also on my medical assistant Facebook, if medical assistant with Miss K, if you're not following me there, make sure you follow medical assistant with Miss K. You can like and follow that page as well and leave a review. For those of you who have passed your test or if I've been helpful to you, just kind of let me know on Facebook. I am working on something, so stay tuned for that. Something that many of you guys have been asking me for. I don't want to say just yet because I'm still working on it. But Shatoria says bye. Okay, Shatoria, have a good day. Um, I'm working on something, so make sure you guys give me a review on Facebook if my channel has been helpful to you. Also, make sure you share with your classmates and your colleagues. My medical assistant group is called the Medical Assistant Lounge. Also, I have some t-shirts at shopwithmissk.com. That's another way to help me too. If you want to show gratitude, is just checking out my t-shirts. And then you all guys can always schedule one-on-one if you need to. The link is in the description of the video. So let me see if you guys have any other questions. I've been a medical assistant for nearly a year and only passed the test because, oh, thank you so much, Joe. Thank you. I'm glad to help. If you can leave me a review on Facebook, that'll be good. On my medical assistant with Miss K page, that will help so much, guys, because I will need the reviews for what I'm working on. Because I'm going to be expanding some things. I'm noticing that what I'm doing on YouTube is something that's needed. A lot of people are saying they're passing their tests because of my videos. I've been helpful. So there are some extra things I'm working on. So if you guys can just review that for me, that way I can start getting these reviews done so people can know that, what I'm doing is legit. So many people out there claiming to want to help. This is genuinely from my heart. I teach this stuff every day. I love what I do. I love my students. I love you guys. I love helping. So just help me out with that. Great job. See the next slide. Okay, Renee. Easy way to remember this. So Myra, it's hard to say. It's going to be up to you. I would say definitely take notes. If you didn't take notes today, go back and watch the replay and take some notes. But everybody is different. Some people need flashcards. Like some of my students, they create flashcards. Some people they have to constantly watch the video. Some people they have to have someone quiz them. So I always say make sure you know the information outright without seeing the options. Like for an example, I have some videos where I do open-ended questions, which I'll do again. But if you can answer open-ended questions and you know the information, because sometimes you can only answer them when you see the options there, multiple choice. But if I ask you a question and you can just outright answer it, like if I was to ask you just something simple like encephalo, what is that in terminology for? If you just know, then you know it, right? If I say what is EOB, what is COB, what is AOB, when you know it, you know it. So Myra, try to work on just knowing it versus knowing it only when you see it. So if you realize you don't know, when I just mentioned that AOB, EOB, and COB, you don't know what that is, then you know you need to go study that. So I would say that. Will these questions be on the current test? This is the yes, a lot of it will be on it because a lot of it is still the same. But I'm doing updated practice so that way people that's taking a test January 10th or after, they have the updated information. But a lot of it is still the same. It's just some added information. So yes, Leslie. Victoria, you're taking your test in December before the new test goes live. Leslie is next month. Okay, Teresa doesn't start school until February. Okay, Teresa, you're getting a head start. You're a godsend. Oh, God bless you. Are we going to see the exact questions? Oh no. Oh no, Wendy. Thanks for asking that. Oh no. We're not going to see the exact questions on the upcoming exams. No. Some questions you may. I will say that. Sometimes people do say that they saw the same questions, but no, 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 no. Don't expect to. Just the content. Okay, Chantori, I'm hoping to take my exam in December or January. The difference between AMA and CCMA. Thank you for asking it. Everybody asks this question. So let me just say this. AAMA is not a test. The AAMA, American Association of Medical Assistants, is not the test. That's the organization that administers the CMA, the Certified Medical Assistant exam. That exam is 5 years. It's a 5-year certification. That exam is broader and bigger than the CCMA. The CCMA is a certified clinical medical exam, and it is administered by NHA. Okay, so the AAMA is not a test. It is the organization. The CCMA is the test that's administered by the NHA. I do have a video breaking out the differences between all of them. Yeah, relatable, Renee. I will be doing more open-ended questions. Leslie, you're welcome. Okay, she's graduating next month on December 20th. Congratulations in advance, Asia. You're welcome, Nanaline. I've been in MA for few, decided to take my. Okay, I'm glad they're helpful. So the one-on-one, Deja, is $24.99. Oh, you see it? Okay. Yeah. So the one-on-one, and the reason why I started doing one-on-ones is that I was found myself when I first started being active on YouTube. I was doing phone calls, hopping on with people and stuff like that. And I just have absolutely, I don't have a lot of time to do it. Every now and then I still will hop on one with somebody if it's a quick question, but for the most part, I cannot do that anymore. And people were like, I'll pay you, blah, blah, blah. So I just decided to do a paid option for the one-on-ones. They're 30 minutes and we can talk about anything you want to talk about. We could do a Zoom or a call. You can, specify which one you would rather do. All right, so let me just see if I had see any more questions. Let me make sure I didn't already skip over any. Make sure you guys like the video, please, if you haven't already. It helps out a lot. And then leave a review on my medical assistant, my Facebook. Let me just put the name Facebook. It's the same as my YouTube, medical assistant with Miss K. The reviews will help me with what I'm trying to develop. I am expanding past YouTube. I am trying to do some things. You guys have been asking for some things from me. And so I am trying to do that. So the reviews will definitely help with getting me out there to help more people. When someone goes to renew their certification through NHA, what's that process like? Oh, it's easy. You just renew your CEU. So when you're on the NHA website, on the left side of the screen, it'll say renew certification. You will see an option to get your CEUs, and it's all free, all on the NHA website. It's every 2 years. As long as you keep up with your CEUs and you renew every 2 years, you never have to take the test again. Okay, Shantora, she says I'm going to look at it again. Alrighty. Every time I end it, I end up seeing in the live, I end up seeing a question that I missed. So I was trying not to miss anything. Just want to make sure I don't miss anything. Again, my YouTube, my Facebook group is called the Medical Assistant Lounge. Make sure you answer those questions to be automatically in. It will decline you. It's automated, so it will decline you if you don't answer the questions and agree to the group rules. You're welcome, Joe. Appreciate the time and energy. We really appreciate it. You really, oh, thank you so much, Joe. Thank you. Thank you so much. All right, guys, I'm going to go ahead and end this. I'm just looking. I just know as soon as I end this, there's going to be a question to pop up. So, guys, let you go ahead and go. And you guys have a great day. Thank you for joining me on this Saturday morning. Well, it's Saturday afternoon now. I don't know what time it is where you guys are, but it's 12:52 p.m. here. I'm Eastern Standard. What time is it where you guys are? It's 12:52 p.m. for me. Let's see what Facebook is saying. Oh, wow. Joe says 8:52 in the morning here. Oh, so what's that? You're on Pacific time? Is that, yeah, that's Pacific. You're on Pacific time. Okay. Oh, wait a minute. That's 4 hours. That's not 3 hours. Pacific is 4 hours. I'm sorry, Pacific is 3 hours. That's where are you, Joe? Where are you located, Joe? Patrona says 1:53. Oh, you're an hour after me. Where are you, Patrona? I know Pacific is 3 hours before me. Central is an hour. But I don't know if anybody that's 1 hour after me. Wow, Patrona, where are you? Oh, Alaska Standard. Oh, Joe is watching from Alaska. Wow, okay. I don't think I've seen anybody here from, not that I can remember, from Alaska. Okay. Okay, relatable Renee, same time zone as me. Okay. Miller, same time zone. Granada, Patrona. Wow. Okay. You guys are watching from all over. This is so amazing. I'm so happy. I never knew when my students asked me to start this channel that we would be communicating and reaching people from all over. Wow. Illinois, Galesburg, it's 11:55 a.m. Okay, I did know that was that Illinois is an hour behind me. Wow, this is amazing. You guys are from all over. You have a good weekend too, Nanalina. New York. Okay, Shania. Hope I said your name right. New York. Okay. I love New York. All right, guys. Let me go ahead and go. I keep saying 12:50. Yep, same time zone in Georgia. All right, guys. You guys have a good day. Let me go ahead and end this because I'll be on here all day reading these comments. All right, guys. So just one more time, just again, just make sure you like the video if you haven't already and subscribe. If you're on Facebook, look me up, Medical Assistant with Miss K on Facebook, and please give me a review. That's going to help me so much with what I'm working on now. Stay tuned, guys, because this is going to be really big, and I will be dependent on your reviews to get this product out there. I'll just say this: it's a product that I'm working on, not the t-shirts that I've been doing, but it's an actual product that I'm working on that's going to be big, and I'm working on it because a lot of you guys have asked for it. So the reviews is really going to help me with getting out there with this product that's going to help, it's going to help people from all over. Okay, so that'll help so much. All right, guys, let me go ahead and stop sharing this screen here. I done said it already a bunch of times. Let me go ahead and get out of here. You guys have a great day. Love you guys. Have a good day.